Greetings, well-beings, Dr. Sherezade back, and today I am on my way to be interviewed by Brian Martinez for a podcast called Growth Snacks. I know Brian because we've done a personal development conference years ago together, and since then we have been partners in crime for living our best life. Here are a few of my favorite moments from the episode. I hope you enjoy. People crave data feels like control. So they crave control. They want to know the data for their blood tests. They want to know the data for their MRIs. They want to know the data, but data without interpretation can actually lead to more fear and harm. It doesn't necessarily mean you have better health. It's a really fine line between knowing the data, wanting, seeking, and trusting the system. They're paying for their own labs on websites and like skipping the doctor altogether, which I'm not against, it's fine, but then they're putting it through ChatGPT and thinking that they're getting real interpretation. The problem with ChatGPT and AI, which I love using AI in my practice, it has been hands down one of the two biggest like game-changing, revolutionary things in my practice. AI doesn't know the difference between a cervix that's like the other side of the vagina that leads into the uterus versus a cervical spine that is the top, the C-spine. Many companies are incentivized to find something wrong because when something's wrong, you have a return customer. So you'll keep coming back to that same thing to fix the thing that's wrong. So that's why it doesn't necessarily support if you just spit into a vial just to get some test results. And you're right, there's a lot of companies, especially the supplement industry, which just thrives off of fear mongering. And that's a really, really big topic that I want to combat medical misinformation on my platform. Usually supplements don't cause any problems. It's just expensive urine. But at the same time, it could cause some liver damage. And I have seen patients firsthand in my office and in the hospital that get liver toxicity from supplements because they're over the counter, they're sent from other countries, and there's just no regulation. Recently, I met the medical director of the Major League Baseball, MLB, and we worked together for about 3 months. And so he taught me a lot about how even professional athletes take supplements. You know, it's part of their health routine. And so the Koreans are very strict with like no anabolic steroid use, no, supplement use. And so they had to like get doctor's notes to say why these supplements are okay and why these supplements aren't. And so he did tell me there was one thing called the NSF, the National Sports Federation, or National Supplement Federation, that does regulate supplements to an extent that the Major League Baseball or the NBA might say like, okay, the supplements within this context could be technically okay, but there's still not enough data or, evidence to prove that they work.
Okay.
Yeah.
But at the end of the day, if I have a healthy diet, then you're saying I'm just spending $150 a month to have more expensive urine. Oh God, I'm so frustrated right now. I don't even know how to. You're telling me that the entire supplement game is just like one big marketing scam?
Yeah.
So
Absolutely. It's like a religion. Like AG1 is a total, like, I don't want to use the word scam. They just get people addicted to them and then people feel bad, but I'm all for something that makes someone feel better. So when I have patients that do bring in all their supplements because I make them because I want to see and we want to go through it together and I want to look at the doses and make sure it's not toxic, especially in combination with the prescription medications, I'm like, they can recognize that, like, so I'm like, so then why do you take this one and why do you take this one? I don't shade or judge them because generally if people feel better and it's not harming them and when we do their blood tests, their kidneys and their liver are normal, that's fine. Take the supplements if you want, but I'm not going to ever prescribe a supplement that's not clinically indicated. So we're in this place of the Ozempic craze, the Mounjaro craze, where people are finding that these medications are helping them lose weight, but these medications have been revolutionary for diabetics and people with obesity. And just because someone's thin or doesn't have obesity doesn't mean that they don't have high visceral adipose tissue. So really the whole movement is for reducing visceral adipose tissue because obesity at its core is a disease of chronic inflammation. And obesity has a higher risk of like 14 different cancers, all the insulin resistance, the metabolic syndrome, the patients who are going through like perimenopause or menopause that really do have visceral adipose tissue. And they weren't like this before, and now they're like this now. They're generally like world-class, groundbreaking medications. And They are peptides. I don't know if you know that, but they are, you said peptides and Ozempic. And I think peptides are just a word for short chain amino acids. So insulin is a peptide. Ozempic is semaglutide is a peptide. Mounjaro tirzepatide is a peptide. They're, they're, they're natural analogs of something that our bodies already have, GLP producers and GIP producers. And I personally don't, like, back to our original thing, I don't think it's fair to judge people who use medications to lose weight when they are quote unquote skinny, because the word is called skinny fat in layman's terms. Like, they could have high visceral adipose tissue. We would know nothing about it. People have metabolic syndrome, fatty liver. So we don't really know what someone's going through if they're taking that medication and why they're taking it. So I think that these medications are generally safe and good, and I prescribe them a lot for my patients, especially when they have clear obesity based on their BMI, especially when they have insulin resistance, and they have been groundbreaking. Like, patients are working out again because they now have the bodies that they can actually go and feel better, like working out. So the lifestyle interventions are 50%, and then the medications are 50%. Like, nothing is 100%, but they do definitely support.
Wait, can you say what you just said again about 50-50?
So the change that needs to take place is probably going to be 50% medication and 50% lifestyle.
Got it.
Nothing can be 100%.
Got it. So if I just take the Ozempic and don't change my practices, it doesn't.
It doesn't matter. Yeah, it doesn't matter. You have to change your practices. And the one practice I love to talk about, because people don't really realize it's that important, is sleep. Sleep is essential for weight loss. It's essential for well-being. It's essential for a good quality of life. And
Yeah.
I have this like little fitness tracker, and this has changed my sleep game. I didn't know what I didn't know, and now I know. So awareness is really powerful. Awareness is so powerful because only after awareness can you make an action and then have a different result. But when awareness becomes your identity, it stunts all growth. And so when people say, like, I have PTSD, or I have anxiety, or I have high blood pressure, I can't run that marathon, or I have whatever I have, and you make it part of your identity, that's when it causes a problem. But it's really up to the person who has the illness to decide whether it's going to define them or empower them and help them thrive. So it's exactly what we went through in that Atlas project, where it's like, are we approaching healthcare or our own health from a place of empowerment, responsibility, or are we approaching our own health like, this happened to me, not for me? And that's a really big distinction. So awareness and overdiagnosis definitely happens, or over identification with our illness. It often happens with cancer. I'm a cancer survivor. I'm a cancer survivor. I am a cancer survivor. That it becomes part of the identity. And that's for no one but the person who's going through or dealing with the diagnosis and the labeling to handle.
But then, all right, I hear what you're saying, that this is so hard for me, because you're basically saying that we can both have PTSD, but how I choose to deal with mine and how you choose to deal with yours is completely up to us.
Mm-hmm.
But I don't operate in this world solo as a lone wolf. I'm in relationship with, my employer, my children, my spouse. And so for the people that are in relationship with them, how are we supposed to hold that when,
Mm-hmm.
if I recognize someone might be attaching too much to this label or using it to make excuses, am I not responsible to call that forward and ask them to be bigger
Great
than that?
question. That's a great question. You're talking about like the human existence, because we're layered with egos and labels and color of skin and age and a sex and all of the things that we have in front of us. But if we're talking about using a diagnosis as an excuse, you're really the only one. They're really the only one. You bring it to them, ask permission, like, hey, I'm noticing you keep saying you're anxious and you're not doing the thing you really want to do because you're hiding behind fear instead of like choosing love. That is totally so private and intimate to that relationship.
But you've done a lot of personal development work, Sherazade. So you can somewhat tell when someone's making an excuse. Yes or no?
Not only the personal development, but like as a doctor and a patient,
Yeah.
it's very intimate, and it's very hard for me to tell whether I push this person to give me a tangible action step that they're going to take out of that doctor office, or let it go, because I'm not going to argue with someone's psyche over something they believe so
Okay, but you can
strongly.
tell that there's an excuse being made, that they're using it that way.
Yeah, but
But
I
you're
really
just
try hard not to judge because I really don't know their experience. I really don't. I
so
don't know what they're going
so
through.
even if your experience is giving you that hit, like this might feel like an excuse or rationale or something so that they avoid responsibility, whatever the case may be, you have to put it on yourself to hold back in that moment.
Yes, absolutely. Because at that moment, especially if I'm wearing a white coat, or if I'm coaching someone, or if I'm working with someone in a relationship and I have the higher level of consciousness, or I have the higher level of like, I don't think this person sees what I'm seeing in them. I definitely hold back until like permission's given or they want that. You know, I kind of ask my patients, like, do you want me to be the softer type of empathetic? Like, yes, I understand. Or do you want me to be like the pit bull in your corner? Like, just, hey, let's get it done. The honey badger that's like, nope, power through, you know, and they'll ask for different things at different times. And that does require me to be flexible. And so I really do. I'm human, so I judge and I know that, but at the same time, it's not really my place to say like that's an excuse. I really hope you enjoyed that. It was so fun to do, and I'd love to see your comments below. And in the meantime, if you haven't seen this reaction video to this incredible show called The Pit on HBO Max, check this video out. Own your health, own your future.